As you're sitting at home watching me speak, we're both using some very vital organs. Our lungs. In this episode, I'll be speaking with Sarah Bush Lincoln's Dr. Preeti Patel about the importance of catching lung cancer early and the new advanced treatments out there to keep you breathing easy.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU's Being Well. I'm your host, Lacey Spence, and today we are getting a second dose of the Patels from Sarah Bush Lincoln over in Mattoon. We now have Dr. Preeti Patel, as you remember. We kicked off the season with her husband, Dr. Jamin Patel, and now we get to meet the fabulous Mrs. So how are you? Welcome to Being Well.
Hi, I'm Preeti Patel. I'm an interventional pulmonologist. I'm from West Bloomfield, Michigan originally.
Okay.
Came into Peoria, Illinois, and now I'm here in Mattoon. Excited to be here.
Wonderful. So did you always know that you wanted to go into medicine?
Actually, I did. My father is a psychiatrist. I knew I didn't want to do that. But I did always know I wanted to do medicine. I really liked how he interacted with people, patients. I liked how he did one-on-one with people and how he got to know them. And that's really what I loved about medicine. And I knew I wanted to do something similar.
Yeah, bedside manner is so important to really connect with your patients and give them the floor to explain, hey, here's what's going on, instead of, just being a number or just trying to get through an appointment. So today we're going to be talking about the lungs, incredibly crucial as we're, I'm sitting here breathing, you are too, everyone at home watching is breathing. And lung health, so incredibly important. And so I think a good place to start would be to kind of explain the difference to us between a general pulmonologist and then an interventional one, which is what you are.
So general pulmonology is basically study of lungs.
Okay.
So we do a lot of treatments for COPD, asthma, shortness of breath, pretty much any breathing issues. Interventional pulmonology, we focus a little bit more on the procedural aspect of things. So how do we go in and do things with procedures to help with those? So the things I focus on are specific procedures using bronchoscopy, which is where we use a camera. We go down the airway and we can look and do different diagnoses. We can do biopsies where we use needles or different tools to take pieces of tissue. So we can find different problems like cancers or infections and help do treatment plans. We can use ultrasounds. We can also do things in pleural diseases. So if you have fluid around the lungs, we can drain those. All different types of things associated with the lungs that we can help with. In Sarah Bush Lincoln, the hospital I work at, we brought 2 new procedures. One is robotic bronchoscopy and the other one is endobronchial valves.
Wonderful. So do you think that's a good place to start talking about the kind of procedures you offer?
Oh, sure.
Okay.
So robotic bronchoscopy ties in really well with my main passion, which is lung cancer. Lung cancer, unfortunately, is the leading cause of death in the United States, which it's the second most common cancer, but the leading cause of death, and that's because we just can't catch it early enough. There's other cancers like colon cancer that my husband treats, and that has a great procedure for screening. You can go and look around for it, diagnose it, and take it out. So they're able to catch that really early. Unfortunately, with lung cancer, they didn't really have a good screening tool. until recently. Now we start by doing lung cancer screening. We do CT scans. So that's one of the things we've brought to Sarah Bush and to the surrounding community is we're encouraging people to get screening. So if you're age 50 to 80, you've smoked for 20 pack years, which means 1 pack a day for 20 years or half a pack a day for 40 years, get screened. Tell your primary care doctor, just get a CT. It's once a year and we can take a look. If you have a tiny spot or anything like that, we can look and take a biopsy, and we might be able to get you treatment really fast. These things don't have symptoms, but robotic bronchoscopy is one of the things where we go in, we take a small piece of tissue, and we can find out what it is.
Gotcha. So you're getting that image, you're getting to look at it, and that's all because of the crucial screening and doing that early and often.
Yep.
Okay.
And it's it's low dose, so it's one of those tests that if you just let your doctor know, hey, I want to get screening, we can do that. It's once a year most of the time, and then if anything looks suspicious, we can keep an eye on it and get a screening sooner. Then the test that we do is a small biopsy. We take a piece of tissue, we can find out what it is, and then if it needs any intervention, we are able to deal with that. The benefit of finding a spot sooner is if it's just one and we know what it is, we can take it out and cure rates are way, way higher. Lung cancer is one of those things, it doesn't have any symptoms. You get a tiny spot, you have no idea. By the time you get symptoms of lung cancer, it's already spread. So now we can screen for it, get rid of it, and you never are bothered with it at all.
No, that's incredible. So when you talk about dealing with it, I'm sorry if I missed it. How do you deal with it? What are you doing with it? Just removing or?
So right now we're doing biopsies for these nodules. Then we refer you over to an oncologist, which is our local cancer doctors over here.
Yes.
And they have different options. So we do radiation therapy if it's a stage 1, or you can do surgery where they can just cut that area out. Depending on the stage, so the size, if it's a little bit bigger, then there's chemotherapy and different types of stereotactic body radiation. New types of radiation and new types of therapies in the last 15 years have even better success rates. But the type 1, the types of localized surgery we can do now is taking less tissue out and has really, really high success rates.
Well, that is great to hear, and hopefully put some people at ease that if they start doing this testing, you can catch this stuff earlier and hopefully help their longevity. So as you're talking about the smoking years, kind of equating that, is it only people who were, I guess, I don't want to say heavy smokers, but is it has to be that they've smoked that much, or is it even people who maybe smoked less, have smoked at all in their lifetime?
So the new guidelines are 20 pack years, so that means 1 pack a day for 20 years. So it's equivalent to that. So you could have smoked half a pack a day for 40 years, but it all has to be within the last 15 years. So if you quit in the last 15 years, so if you're more than 15 years smoke-free, your risk of lung cancer is equivalent to that of the general population.
Okay.
So there are studies that show that if you haven't smoked for 15 years, your risk is equivalent to everybody else's risk, which is a good thing.
Yeah.
But if it has been that you've quit in the last 15 years, we still recommend that you get screening.
Okay, and then I feel like I might be hearing the answer to my question already, but secondhand smokers, is there any sort of risk for them?
Yes, so a lot of studies are showing that secondhand smokers, they have unfortunately equivalent risk to primary smokers. So those people, and go to your doctors and say, hey, I have a lot of secondhand smoke. My mom and dad smoked in the house, or brother, sister smoked in the house, anything like that, and let your primary doctor know. They can refer you to the pulmonary clinic, and we can evaluate you and see if your insurance will meet criteria.
Gotcha.
So we still recommend that you get referred to us.
Good to know. I feel like people are able to breathe a little easier now that there's not so much of the smoking or non-smoking section at restaurants or things of that nature.
Definitely.
But sometimes if it's in the family, it is unavoidable. So there's another procedure that you're able to perform, and I'm going to reference my notes because I don't want to mess it up. Endobronchial valve replacement.
Yes.
Can you tell me, break it down for us, please?
So a lot of my procedures have to do with smoking. So.
Okay.
Smoking cessation, we're really encouraging quitting smoking. But unfortunately, these people are paying for smoking that they've done at a young age. You smoked when you were younger, you quit. Now you've quit, but you're still paying for it. That doesn't seem fair. So you're getting your screening, you don't have any cancer, but you're still short of breath.
Yeah.
So you do all your inhalers like your doctor tells you to, but you got COPD. You're using your oxygen, you just can't walk that far, you can't do the stuff you want to do, you're exercising, you're doing everything you should. It's not fair. So unfortunately, there wasn't a lot of options before. So there used to be something that people would try to do, which was lung volume reduction. It was a surgery, but surgeons were not offering it to very many people because it was quite a big procedure. They would go in and cut out the damaged part of the lung to try to reroute air to the better parts of the lung. But as you can imagine, trying to surgically remove a part of your lung, you had to be just healthy enough to get it, but bad enough to deserve it. So there was a very narrow window of time that you could get that, and very few people recovered well enough that it was worth it. So now we can do endobronchial valve placement. So what that is it's just like lung volume reduction surgery without the surgery.
Love that.
Yep. So what we do is we go in with the bronchoscope with that camera and we put in these little one-way valves into the most damaged part of your lung. The one-way valves will help let air out of that part of the lung, but won't let air go back into that part of the lung. So what that does is it collapses, functionally collapses, the part of the lung that's most damaged. So when you take a nice breath in, instead of air going to useless part of the lung that's damaged, it will reroute to the better parts of the lung. So you take a nice deep breath. Instead of half your air going to a damaged part of the lung and being wasted each time you breathe, so you only get 50% of the breath, you get all 100% into the better parts of your lung. The best part of this is it's not a full surgery. You didn't lose that part of the lung, we just functionally collapsed it. So if something were to happen and you didn't tolerate it very well, I just sneak right back in there and I can pull those out and I can reopen that part of the lung. So it is completely reversible.
Gotcha. Well, I'm sorry if it's a dumb question. So once that part of the lung is not getting air anymore into it, what happens to that tissue as it's just kind of sitting there?
It is completely collapsed, so it's called atelectasis. So it just stays there collapsed, and really it just stays like that, closed. So nothing happens to that tissue, it just stays there in your lung, and on your chest x-ray it'll look like collapsed lung. And those valves stay in place and they can stay like that forever. They don't need to come out or nothing needs to happen to them. But if for some reason you need those out, you would be able to get those pulled out.
Okay. Very cool.
Yeah.
I didn't realize that you could go in and do such minute surgery that way now in the lungs. So that's so cool. So talking about COPD, you mentioned, if I'm somebody who's not been diagnosed with it, but I might suspect or I might be having some symptoms, at what point should I reach out to my doctor? What am I looking for?
So if you're short of breath, if you were a smoker or you're currently a smoker and you're tired of being short of breath, that's always the time. You go to your doctor and you say, hey, I'm a smoker or I used to be a smoker, I'm short of breath, can you take a look? I might just not be feeling well. If there's ever an issue and you feel short of breath, it never hurts to ask. A pulmonary function test is the first test that is basically the screening that we use. So that's a breathing test that we can do where you breathe in and out in a smaller type of body box, and we can calculate your lung volumes. We use those volumes to get an idea of what your function is for your lungs. Using those, we can tell if you have COPD, which stands for chronic obstructive pulmonary disease. And that's the first trigger for us to know what type of workup we can do.
And so if I've been diagnosed with that, then what's next for me?
Then usually we start with a treatment plan. So diet and exercise are always part of my treatment plans because they are invaluable to a successful and healthy medical treatment plan.
Sure.
If you have a good, healthy lifestyle in any of the pulmonary diseases, you will be successful. Inhalers are really important for what we do, so we use bronchodilators as the mainstay of treatment for most of these. So that's albuterol, which is a short-acting bronchodilator. Usually you use the puffers that you see people using. That you just take 1 or 2 puffs. People do it before exercise. Those ones open up the airways. And then some people have or need longer acting ones. So we use a combination of those types of therapies to help open up the airways. And then sometimes people need oral steroids, which are those steroid pills,
Okay.
to help bring down swelling or inflammation in the airway. Any combination of that plus oxygen plus exercise. But COPD, much like diabetes and other medical conditions, they're chronic or long-term, so they need ongoing management. That's why being worked up and doing things every single day to help with your breathing will be very, very beneficial for you. And something like valves, if you're doing everything you can, will help improve your lung function.
Okay. Well, and I feel like a decent place to kind of pivot as you're bringing up inhalers. Can we talk about asthma a little bit? For the folks at home who maybe aren't sure what it is, when it can set in, can you talk about all of that?
So asthma, you could have at a young age, at an older age. Asthma is actually usually called bimodal. What we say is bimodal. So usually you have it at a younger age, bad, and you can get it again in your 50s.
Oh.
Some people have asthma lifelong, but a lot of times you'll see it, you haven't had symptoms growing up, and then suddenly when you're older, you'll say, gosh, I feel like I'm getting short of breath. Mainstay is usually with wheezing, and some people will get cough. But if you're getting short of breath and you're not really sure why that's happening, you exert yourself, you get short of breath, environmental things could be bothering you, it might be asthma. If you have allergies, it might also be asthma if that's related to your breathing. There's different types, so there's a type 1, type 2, there's also a cough variant, but all of these, anytime you're short of breath, if certain things seem to bother you more than others, tell your doctor and then we might be able to do some testing to find out. Opening up your airways, bringing down swelling, those are things that will help a lot in asthma. Keeping a clean environment, free from dust, testing what things are triggers for you and avoiding them, those are the main things that help with asthma.
And that can be so much as pet dander.
Yep.
As well, animals.
Pollen, unfortunately, dust, unfortunately. Things that are very common can really mess you up with asthma. So it's best to know. Allergy testing is very helpful for some people. Sometimes it's one thing that really bugs you, and if you can avoid that, that would be best. And then asthma can be very dangerous. So it's best to know if that is what is causing your breathing disorder, because it could be that it builds up for a while and then it just flips the corner and you could just really get your airways completely collapsing. So you really want to know if that is what's happening to you. You want to have a plan in place, which we call an asthma action plan, to open up your airways quickly so that you're not in any danger.
Mm-hmm. When they completely collapse, is that when people will call it like having an asthma attack, or is that something different?
Yes, that's asthma attack. The medical term for it is status asthmaticus, and it's when your airways are, or silent chest, where you're not moving air at all, and that is a medical emergency. So that's where, if you were to listen to them, you don't feel like they're moving any air at all. That's when the airways are so tight that you're not able to get air in and out. And that is really dangerous, so we want to make sure. Asthma attack, you'll usually hear that wheezing, that kind of inhaling wheezing sound. That means that the airways are so tight that you're hearing that stridor, that air going in and out through the narrowed tubes. So we need to stretch those back out. Mm-hmm. That's what bronchodilators do. They open up the airways again. So albuterol is usually a great thing to use in those times to try to stretch the airways back out.
With the absolute collapse, is that a call 911, get to the ER?
Yeah, right away.
Gotcha. Okay, so to move back to kind of general lung health, is there anything about this topic that I haven't asked that you think is really important for people to know?
Exercise is my main thing. If everybody stays active, it is always good. So no matter what level of lung disease you have, be it just a little bit of damage, some smoke exposure from the past, or still a heavy smoker, if you can support weaker lungs with muscles, you will do better. So what I mean by that is just simple walking every day, 20 minutes a day, that will help strengthen. When your lungs are a little bit weaker, if you have muscles to support them, then when you get yourself in trouble, you get pneumonia, you get a viral infection, those muscles can make you stronger. So it's always better to try to stay active. You don't have to spend a ton of money by going to the gym, but walking 20 minutes a day, that's very helpful. And then trying to just do basic precautions, stay away from people that are coughing, frequent hand washing. Those simple things of good hygiene are always important for upper respiratory infections. Be careful right now, we've got parainfluenza, RSV, especially as the winter comes, those viral infections, if you just keep with hand washing and protective gear, then you should be pretty safe.
So when it comes to lung conditions, is it typically the older crowd that's impacted, or are there conditions in younger patients as well?
So younger patients are very susceptible to RSV, and the younger patients and the older patients are very similar. So the daycare age population and the older population, they tend to have the same types of viral illnesses. So influenza, RSV, parainfluenza are very similar in both. And the severity is similar. So bronchiolitis, that upper airway wheezing, similar to the asthma we talked about, when you hear that stridorous, high-pitched wheezing, those types of things can happen in young babies and in the older crowd as well. So getting your vaccines, that's extremely important. Flu shot, as much as we don't like all these vaccines, they minimize your risk of having severe complications. So the physician population, the medical community does always recommend that you stay up to date on those.
And so as far as connecting with you as being a specialist, do I typically go through a primary care doctor before I seek your expertise, I guess?
Yes, so I'm easily available through a referral to SBL Pulmonary. So you can just put a referral through the pulmonary clinic and you'll be able to get to me. So all you would have to do is add Dr. Preeti Patel, that's my name, and we'd be happy to see you and evaluate you for any interventional pulmonary needs.
And so as you were talking about some of the different procedures that you perform that are a little more specialized, have you had any cases that you can kind of generally talk about? What kind of impact did you have on these patients? What was their reaction after they had these procedures?
Thankful, which is very nice. Coming to a community like this, I am thankful. They are thankful. It is very nice to be here, and I'm just very happy to be here. It's something new and exciting to be in a population that didn't have this type of procedure before, and it's really exciting to be here. To see that. I have had now a couple patients. We've done 25 of the ION cases as of now, and that is remarkable because we've been 3 months off the ground. And it is just really nice to see that patients that they had to travel to St. Louis or Indianapolis to get this procedure done before, and to be able to do that locally in their community, that is really, really exciting. When the important thing about this robotic bronchoscopy is that it can get to lung nodules that you couldn't get to before, and you would have to travel to a bigger city. And a lot of the patients that we see in this community, they don't have the means to travel to bigger communities.
Sure.
They don't have the ride. You have to take somebody with you, and that's a whole day off work or multiple days off work. It just wasn't feasible, and they didn't want to leave close to home. They didn't have access, and these potential stage 1 cancers were becoming stage 2, stage 3. They were spreading because they weren't getting the care that they needed because they couldn't get there. And it's just, I'm very thankful that we're able to do that now. We're able to get them the care that they need. But yes, I've had multiple patients just happy to get answers. Even ones that didn't turn out to be cancers, we found a couple infections, fungal infections that got treatment right away, where they were so worried that it was cancer and it turned out it wasn't. And that was very exciting to find out, hey, we've been so worried and we haven't been able to get a biopsy, and we found out it was an infection, and so much relief.
Oh yeah.
So it's good to be able to get some answers.
Yeah. In our last couple of minutes here, kind of nuts and bolts, if I'm getting this procedure, is it something I'm put under anesthesia for?
Yes, so you will be with a breathing tube and a ventilator. It is under general anesthesia. It usually lasts about an hour or two.
Okay.
You will have full monitoring and you'll be asleep the entire time. We go over the risks and benefits before the procedure, and then we take that breathing tube out and wake you up right after the procedure, and then I go over kind of what I found right after. And then you stay with us for about an hour or two. We make sure you can swallow and everything, and then you head home the same day. It's an outpatient procedure.
Love that. I think recovering in your own home is one of the best advancements that we've made in recent years as far as taking care of people. Well, Dr. Preeti Patel, our time here is up. Thank you so much for joining us on Being Well.
Thank you so much.
Of course, and we thank our viewers for joining us. We hope you will breathe easy knowing a little bit more about lung health, and we hope that you'll join us in the next episode.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.